This is about 15 minutes after we completed treatment, and we're going to remeasure the pubic structure. So at the very top of it, I place a finger across, add a thumb, and a finger, and then I place this device there with the black tape right in the midline. Okay, so I'm trying to lay this perpendicular to the plane of the joint, all right? And other than the fact that it's upside down, life is good, okay? So we had a thumb here, we had a finger here on the pubic joint. The thumb is above it, okay? And then below that finger is where we're going to place it. I can feel the indent of the fibrocartilage here, congruent with this 1/4 inch wide seam on your shorts. And then bone here, okay? Out here is the obturator foramen, okay, about 3/8 inch out there. So if I lay this right here, I'm still on bone, okay? And I'm attempting to be perpendicular to it, and I'm pushing these little guys in with moderate force. Very little change, and I believe this to be the the obturator foramen.
Yeah, thanks so.
Ask me if I slept well last night. Okay, I couldn't move these down. These guys were immobile. We are seeing a straight across, and if I come on the pubic bone way out here in the obturator foramen, okay, obturator foramen, climb onto pube, okay, come across pube onto fibrocartilage. It's almost a straight line.
Wow.
It's almost like your fibrocartilage is in line with the pubic bones. There's the slightest difference there as I walk across. I think you can feel that. But that speaks to an alteration. Now, if you'd lie on your stomach, we can do the spring test again.
Okay.
Okay. The sacrum looks symmetrical, but we don't really trust how it looks.
So it doesn't feel that way anymore?
Correct.
Oh, great.
Correct. Doesn't feel rotated left. Now I can take up the slack, and when I spring it, I see that left foot move. So the movement goes in through the pelvic structure, down through the hip, down into the lower extremity. It feels different to you.
Yeah, it felt like glue when you would press it before. It just felt like you were pressing rock. You know, that wasn't going anywhere.
And this is the flat part of the ischium. I can take up the slack. I can see the heel move. And when I spring it, I see the movement go through the pelvic structure into the hip, into the lower extremity. So we now have movement there. The sacrotuberous ligament here, very distinct, there it is, and I can indent it. No longer feels like rock. Okay? Sacrospinous is out here, and I can indent that as well.
It still feels tough to me. Does it to you?
It's a strong
but
ligament.
It's different? Okay.
It's a strong ligament. It yields.
Okay.
Could you feel that it yields? Okay. So that is that. You're giving me some feedback that you feel differently when I do that.
Yeah, especially the spring one feels different because before it just felt like you were just pressing and nothing was happening.
Okay. So I'm going to stop filming here. I'm going to do the next film, which will be to show the functional response. Is there a change in your strength in the foot and ankle, in the trunk, and in the head, in the neck?